Oral health in California has struggled to be a priority, as I think is the case in many other states.
Look at all the people.
And one of the issues that we face is that a significant portion of our patient population have had very limited access to oral health care from childhood to the point where we see them.
The amount of money that it's costing the state of Florida for ER dental visits, it's somewhere around $88 million.
Before 10 years ago, no one in the medical community was having a conversation about oral health. It was really this great medical and dental divide.
We started to coordinate better. We had a reason to come together and plan together. So I think that's been the most exciting thing.
We're working with emergency room doctors.
We've really brought people together that are all focused on the result and are starting to figure out how to take aligned actions together.
If we can just get the word out.
To watch connections among people at the table, to realize a vision and have that light go off is an absolutely phenomenal experience. And I truly believe that the impact that we are making in our states is going to be realized in a disease-free, healthy population eventually, and that's a wonderful thing to be a part of.
Come on over here. Come on over here.
Can you believe what has just happened in the last 18 months? It's that national planning that's going on, but it's the grassroots response that's making the difference. But it takes the top and the bottom to come together in the middle.
Yeah, I think this one works better.
There is a movement underway. There's a groundswell of support coming to make oral health a big factor in everyone's life, and that everyone has a right to good oral health.
Not only do we have a vision, but we have a fully implementable plan.
We have an obligation to start spreading the word and enlarging our group with this collaborative, integrated kind of approach.
Yes, we can brush our teeth. Yes, we can floss. But at the end of the day, it's not just our oral health, but our entire body health.
The biggest challenge in implementation is keeping stakeholders engaged.
It's about fairness, right?
This initiative has helped us to do that because we've had some eye-opening experiences, some eye-opening remarks come from participants, key stakeholders who are realizing that there is a need to discuss and figure out some solutions to improving oral health.
We were so well positioned to address many of the focus areas that were being offered by the National Oral Health Alliance. And immediately, medical-dental collaboration jumped forward, as did the public health infrastructure around prevention.
Oral Health 2014 initiative has allowed us to really shine a light on early dental visits for kids.
This is a fluoride base. I see more sealants going on the kids' teeth. I see us addressing the emergency room utilization for dental emergencies. I see policies developing, a whole lot more policy around oral health.
Our successes have started with working with the DC Department of Health to get the state Medicaid plan approved for reimbursement of fluoride varnish.
I mean, I think what we're really trying to do is to create win-win situations. That's what we're in the midst of doing through this grant, so that no one can say no when we're trying to increase oral health access for children.
There's curriculum change happening at every medical school in the state, and we have champions that are leading that program. And while we can provide assistance, and the Smiles for Life curriculum is certainly there for them, it's something that is very internal to each program where it's occurring, and that's been great.
Our physicians are applying fluoride varnish in the office to children in need. And when we're caring for older adults, their oral health is now a subject of conversation as part of managing their other medical diseases.
Dr. Clark, Mrs. Caldwell is here.
Thank you. You know, where we are right now is that we've set the agenda, we've put it on the table to say that oral health has to be considered with all the other health issues, whether you're talking about hypertension, heart disease, stroke, obesity. Oral health is in there as a main area that needs to be addressed.
That's one of your impacts.
I think we're getting great traction.
Right at the forefront.
It's amazing to me how much work has been done. An incredible effort across a variety of sectors, public and private. The foundations have really stepped up. We're past the question of if or should we, it's a question of how. And I think that, 5 years from now, we won't even be asking the same question. It will be part of comprehensive health care.